Welcome to GNP Sir Classes official channel. In continuation of the lecture from Professor Govind Narayan Purohit on the drugs acting on the digestive system, in today's talk Professor Govind Narayan Purohit explains the antidiarrheal, anti-emetic, and digestant drugs. First, let us talk about diarrhea. Diarrhea is the abnormal increase in frequency, fluidity, or volume of feces due to excessive fecal water content. It can be caused by infectious agents and pathophysiological processes, increased osmotic particles, fluid, iron secretion, mucosal permeability breakdown, altered motility. Antidiarrheal drugs have been classified as follows: non-specific antidiarrheal drugs, gastrointestinal protectants and adsorbents, kaolin, pectin, bismuth salts, activated charcoal, cholestyramine. Antimotility drugs, opioids, tincture of opium, codeine, diphenoxylate, loperamide. Anti-secretory and anti-inflammatory drugs, salicylic acid derivatives, sulfasalazine, mesalazine, anticholinergics, atropine, hyoscine, miscellaneous, NSAIDs, glucocorticoids, clonidine, octreotide, resveratrol. Miscellaneous drugs, tannic acid, catechol, carboxymethylcellulose, psyllium. Specific chemotherapeutic agents, antibiotics, streptomycin, neomycin, ampicillin, succinylsulfathiazole, enrofloxacin, nitrofurazone, furazolidone. So first we talk of non-specific antidiarrheals. A. Gastrointestinal protectants and adsorbents, coat mucosal surface or adsorb toxins. Kaolin, hydrated aluminum silicate, used as an antidiarrheal and adsorbent. Often combined with pectin. Pectin, carbohydrate polymer, adsorbent and protective properties. Used with kaolin. Bismuth subsalicylate, anti-secretory and antibacterial activity. Metabolized to bismuth and salicylate. Caution: black stools, salicylate toxicity in cats, nephrotoxicity, especially with aminoglycosides. Activated charcoal, excellent adsorbent, used for poisoning. B. Antimotility drugs, opioids, increase intestinal tone and segmental activity, reduce propulsive movements, diminish secretions, and enhance absorption. Inhibit acetylcholine release. Diphenoxylate, synthetic opioid, that slows intestinal contractions. More potent than morphine, can cross the blood-brain barrier. Loperamide, synthetic opioid, that acts on microreceptors, with anti-secretory effects. It is more potent and has a longer duration than diphenoxylate. C. Anti-secretory and anti-inflammatory agents, salicylic acid derivatives, sulfasalazine, for inflammatory bowel disease. Hydrolyzed in the colon to release 5-aminosalicylic acid, anti-inflammatory. Anticholinergics, reduce gut secretion and motility, atropine, hyoscine. IV. Specific chemotherapeutic agents, antibiotics for infectious diarrhea, aminoglycosides, penicillins, sulfonamides, nitrofurans, quinolones. Use should be judicious and based on culture and sensitivity testing where possible. V. Fluid and electrolyte replacement, oral rehydration solutions, ORS, for mild to moderate dehydration. Intravenous rehydration, for severe dehydration, greater than 10% body weight, or when oral intake is insufficient. D. Miscellaneous antidiarrheal drugs, intestinal astringents, precipitate proteins, and form a protective layer, tannic acid, catechol. Other, carboxymethylcellulose, psyllium, polycarbophil, fiber supplements, increase viscosity. Now let us discuss emetics and anti-emetics. First let us talk about emesis. Emesis, more commonly known as vomiting, is the involuntary, forceful expulsion of the contents of the stomach through the mouth, and sometimes even the nose. Vomiting is a common non-specific condition that affects small animals, pot-bellied pigs and some exotics. Vomiting is not routinely seen in horses, camelids or ruminants. Emetics are drugs used to stimulate vomiting. The emetics can be classified into locally acting and centrally acting emetics. I. Locally, reflexly acting emetics, irritate the epithelium of the oropharynx, esophagus, stomach, and duodenum. Lukewarm, tepid water, for non-corrosive substance poisoning. Sodium chloride, crystalline or saturated solution. Induces emesis in 10-20 minutes. Caution: excessive intake is harmful. Copper sulfate, 1% solution, induces vomiting in 30-45 minutes. Zinc sulfate, 1% solution. Hydrogen peroxide, 3%, induces rapid emesis in cats and dogs. Ipecacuanha acts locally, gastric mucosa irritation, and centrally, CTZ stimulation. Vomiting within 15-30 minutes. Caution: high doses cause cardiotoxicity. 2. Centrally acting emetics stimulate the vomiting center or CTZ. Apomorphine, non-selective dopamine agonist, stimulates CTZ. Potent emetic induces emesis in 3-10 minutes, SC, conjunctival. Followed by exhaustion and depression. Pharmacokinetics, parenteral, topical administration preferred. Metabolized in the liver, excreted in urine. Side effects: respiratory, cardiac depression. Clinical uses: choice emetic in dogs. Ineffective in pigs, and contraindicated in cats. Xylazine, alpha-2 adrenergic agonist, sedative, analgesic. Effective emetic in cats, choice emetic, less so in dogs. Vomiting within 3-5 minutes, parenteral. Followed by sedation. Contraindications to emetics: corrosive poisoning, acids, alkalis. Unconsciousness, coma. Esophageal obstruction. Late poisoning. Ingestion of foreign objects, sharp. Petroleum products. CNS excitation, e.g., strychnine. CNS depression, including existing depression or apomorphine-induced. Species that lack a vomiting mechanism: horses, ruminants, rodents, rabbits. Geriatric, weak patients. Pregnancy. Certain pathological conditions, surgery, prolapse, hernias, recent abdominal surgery. Antiemetics are drugs used to prevent or suppress vomiting. They are classified as locally acting and centrally acting. Locally, peripherally acting antiemetics. Demulcents and protectants, coat, protect, lubricate, and soothe irritated gastric mucosa. Example: kaolin, pectin, bismuth salts. Gastric antacids and local anesthetics, for vomiting linked to gastric acidity. Example: magnesium hydroxide, aluminium hydroxide, and benzocaine. Anticholinergics inhibit vagal impulses and reduce smooth muscle spasms and secretions. Example: glycopyrronium, metscopolamine, and propanthaline. Side effects: xerostomia, mydriasis, tachycardia, urinary retention, ileus, gastric retention. Prokinetics promote peristalsis and accelerate gastric emptying. E.g., domperidone, cisapride. Domperidone, antidopaminergic, prokinetic and antiemetic. Stimulates gastric motility via D2 receptor inhibition. Acts on CTZ. Cisapride, prokinetic via 5-HT4 receptor stimulation. Less effective antiemetic. 2. Centrally acting antiemetics. Block impulses at higher centers and/or emetic centers. H1 receptor antagonists, for motion sickness, inner ear disease. Example: maclozine, cyclazine, cinnarazine, dimenhydrinate, promethazine. Maclozine, antihistaminic, anticholinergic, CNS depressant. Side effects: sedation, dry mouth, tachycardia. Cyclazine acts on CTZ. Side effect: drowsiness. Cinnarazine, H1 receptor and calcium channel blocker. D2 receptor antagonists block D2 receptors in CTZ. For drug, anesthesia, malignancy, chemotherapy, radiation sickness, systemic disease-induced vomiting. Phenothiazine derivatives, e.g., chlorpromazine, blocks dopamine receptors in CTZ. More effective in dogs than cats. Butyrophenone derivatives, e.g., droperidol, haloperidol. D2 receptor antagonists. Dosage, not specified, benzamides, e.g., metoclopramide, trimethobenzamide. Potent D2 receptor blockers, antiemetics. Metoclopramide, prokinetic and antiemetic. Inhibits D2 and, high dose, 5-HT3 receptors in CTZ. Trimethobenzamide, prevents nausea and vomiting. 3. 5-HT3 receptor antagonists block 5-HT3 receptors in the gut, CNS, vomiting center. E.g., ondansetron, granisetron, tropazetan, dolisetron, cyproheptadine. Ondansetron blocks 5-HT3 receptors in vagal efferent in CTZ and NTS. for cisplatin, chemotherapy, radiation-induced emesis. 4. Muscarinic receptor antagonists, e.g., hyoscine, dicyclivarine, aminopentamide. 5. Miscellaneous drugs, glucocorticoids, e.g., dexamethasone, methylprednisolone. Benzodiazepines, e.g., diazepam, lorazepam, midazolam. Cannabinoids, e.g., dronabinol, nabilone. Alpha-2 adrenoceptor antagonist, e.g., yohimbine. Drugs affecting digestive functions, digestants. Digestants promote digestion, extracted or synthesized. Useful only if endogenous production is deficient. Classification of digestants: I. Pancreatic digestants and analogues, pancreatin, pancrelipase, diastase, takadiastase. 2. Gastric digestants and analogues, pepsin, papain, hydrochloric acid. 3. Hepatic digestants and analogues, A. Cholagogues, magnesium sulfate, sarultide, aloes, ammonium chloride, ipecacuanha. B. Choleretics, ursodeoxycholic acid, chenodioxycholic acid, dihydrocholic acid, glycocolate, taurocolate, fluorenterone, tocamphal, clanobutane, ox bile extract. I. Pancreatic digestants and analogues. Exocrine pancreas, digestive enzymes to duodenum, peptidases, lipases, amylases. Deficiency in chronic pancreatitis, pancreatic insufficiency. Pancreatin, pancrelipase, amylase, proteases, lipase. Used in pancreatic insufficiency, cystic fibrosis, etc. Pancreatin, alcoholic extract of hog, ox pancreas. Contains amylase, proteases, and lipase. Enteric-coated preparations are preferred, less inactivation in the stomach. Used for diarrhea and weight loss due to pancreatic insufficiency, AP. Dosage, adjust based on patient response. Start with 2 teaspoons powder, 20 kg BW per meal, non-enteric coated. Decrease dose as improvement occurs. Note: raw ox, pig pancreas, 100,120 grams, 20 kg BW, can be a cheaper alternative. Pancrelipase contains higher lipase content than pancreatin. Properties, actions, adverse effects, use similar to pancreatin. Dosage: dogs, 1-2 TSP mixed with meal, 3x daily. Cats, 0.50.75 teaspoons mixed with meal. Diastase, amylase enzyme, breaks down starch. Used for pancreatic amylase replacement, starchy dyspepsia with hyperacidity. Dosage: 0.060.3 grams, total, phosphorus monoxide. Takadiastase, amylase from Aspergillus oryzae, used in dyspepsia, debility. Dosage: 0.060.3 grams, total, phosphorus monoxide. 2. Gastric digestants and analogues. Pepsin, proteolytic enzyme from hog stomach. Active in acidic medium only. Used for indigestion, gastric achilia. Give after meals with dilute hydrochloric acid, 0.4%. Dosage: dogs, 0.30.6 grams, total, orally. Foals and calves, 2.64 g, total, orally. Papain, cysteine protease from papaya. Papain, vegetable pepsin, digests 35x its weight in meat. Acts in acid, neutral, and alkaline pH. Digestant, mucolytic. Dosage: dogs, 0.30.6 grams, total, orally. 3. Hepatic digestants and analogues. Liver secretes bile, important for fat digestion. Bile acids promote fat digestion and absorption of fatty acids, fat-soluble vitamins. Physiology of bile acids. Synthesized from cholesterol, cholic, chenodioxycholic acids. Conjugated with glycine, taurine, sulfate, glucuronide, stored in the gallbladder as bile salts. Secreted into bile canaliculi, absorbed in ileum, enterohepatic cycle. Intestinal bacteria modify bile acids, deconjugation, dehydroxylation. Ursodeoxycholic acid formed from chenodioxycholic acid. A. Cholagogues. Promote bile flow into the intestine, gallbladder contraction. Dietary fat, Mg, Na sulfate into duodenum, sarultide stimulate via CCK release. Aloes, ammonium chloride, ipecacuanha, and mercurous chloride have a cholagogue effect, no therapeutic use. Vagal stimulation promotes gallbladder contraction. Limited use in veterinary medicine. B. Cholerectics. Increased bile output from the liver. Hydrocholerectics, increased bile output with low specific gravity. Bile salts are used therapeutically, promote fat absorption, stimulate biliary secretion. Ursodeoxycholic, chenodioxycholic acids for gallstone dissolution, humans, small animals. Lithocholic acid is toxic, ursodeoxycholic acid is beneficial in cholestatic liver disease. Ursodeoxycholic acid, UDCA, ursodiol, secondary bile acid, hydrophilic. Used for chronic hepatobiliary disorders, dogs, cats, humans. Mechanism: decreases cholesterol in bile, inhibits intestinal absorption, suppresses hepatic synthesis, may involve other mechanisms. Chenodioxycholic acid. Primary bile acid is used to dissolve cholesterol gallstones. Acts by inhibiting cholesterol synthesis and solubilizing cholesterol in bile. More toxic than ursodeoxycholic acid, especially in dogs. Can cause diarrhea, increased liver enzymes, and increased cholesterol in humans. Contraindicated in pregnant animals due to potential fetal abnormalities. Not recommended as sole therapy, usually combined with ursodeoxycholic acid. Ursodeoxycholic acid, UDCA, decreases cholesterol saturation in bile, promoting gallstone dissolution. Protects hepatocytes by displacing toxic bile salts. Produces bicarbonate-rich hypercholeresis, enhanced bile flow. May have immunomodulating effects. Well absorbed orally, conjugated in the liver, and excreted in bile and feces. Generally well tolerated, diarrhea and GI effects are rare. Useful for cholesterol gallstones, less than 15 mm, and chronic liver diseases with cholestasis. Dosage: dogs and cats, 10-15 mg per kilogram orally once daily. Dihydrocholic acid. Synthetic bile acid that increases bile volume and water content, hydrocholeresis. Does not increase phospholipids, cholesterol in bile, may decrease bilirubin excretion. Used to prevent bile sludging and improve drainage. Recommended in cats with cholangiohepatitis. Also a stimulant laxative. Dosage: dogs and cats, 10-15 mg per kilogram orally 3 times daily. Cattle, 3 g/IV. Other drugs: cholerectics, glycocolate and taurocolate enhance bile flow, lesser extent. Fluorenterone and tocamphal are synthetic cholerectic agents. Clanobutane and methoxynaphthalene oxybutyric acid are used as cholerectics in veterinary medicine. Ox bile extract is prepared from ox bile and contains sodium salts of bile acids. Cholagogue. These are drugs which cause contraction of gallbladder and increase the bile flow into the duodenum by relaxing the sphincter or D, help in digestion of food, relief from indigestion, bloat. Dietary fat and concentrated magnesium sulfate introduced directly into the duodenum through a tube exert a cholagogue effect. Example: arachaline, oxytocin, podophyllum, calomel, mercurous chloride. Cholekinetics, drugs which merely cause contraction of the gallbladder. Cholerectic. Substances that increase the secretion of bile by the hepatocytes, liver, are known as choleretics. Production of bile is enhanced by stimulation of vagus nerves and by the hormone secretin, which increases the water and bicarbonate content of the bile. A drug that stimulates liver to increase output of bile of low specific gravity, dilute bile, is called a hydrocholeretic. Example: natural bole salts like glycocolate, taurocolate and liver extract. Thanks for watching. Kindly like, share, comment, and subscribe. GNP Sir Classes official channel.